Hi, my name is Tiffany. I am doing assignment number 1 for Nurse 518. I saw a 48-year-old male today who presented with a 4-day history of fevers and a worsening cough. Initially the cough was dry and then became wet on day 4 with thick, wet and productive with thick green sputum. He is describing some right-sided lung pain, as he calls it, when he coughs. It is localized and non-radiating to that right side. His cough seems to be worse when he's lying down. When he talks quite a bit, he has to talk a lot at work, so when he gets talking he tends to cough a little bit more, and with exertion. Cough does seem to be worsening, which is why he came in today. Other symptoms of note, his fever has been ongoing. He's been treating with Advil and Tylenol with effect. Last dose was about an hour ago. He's got mild shortness of breath on exertion. Also some upper respiratory tract infections, intermittent headaches, some nasal congestion, some ear fullness, and a resolving sore throat, which is now just feeling more itchy than sore. Pertinent negatives, no centralized or radiating chest pain, and he has no shortness of breath at rest. Previous medical history, he did have pneumonia in 2016 as well as 1994, and he was treated both times successfully with amoxicillin. Also a history of hypertension. He is compliant with his ramipril, which he takes daily. 2.5 is the dose. No allergies that we know of, and his vaccinations are up to date. He did have both a COVID and a flu vaccine this year. His vital signs, current temp is 36.7, heart rate is 82, rest rate is 20, blood pressure was 148/75, and he's satting 94 on room air. Hemoglobin is 142 and his blood sugar is 6.2. Neurologically intact, nothing abnormal there. With regards to his respiratory assessment, no increased work of breathing that I could see, but he definitely did have some audible crackles in his right lower lobe, as well as some decreased air entry. No wheezes or rhonchi, and I did hear him cough, and it definitely sounds quite wet. What else? His heart, S1, S2 is audible, no extra heart sounds, nice and regular. And I forgot to mention, a little bit of nasal congestion. His bilateral TMs are intact, no redness, a little bit of bulging. And his throat, mucous membrane's moist, and his throat is pink, no exudate, and his tonsils were not visible. So in summary, I'm calling him RN, is a 48-year-old Caucasian male with a history of hypertension, who presents with a 4-day history of fevers and worsening, now productive cough with thick green sputum. On assessment, he did have coarse crackles and decreased air entry to the right lower lobe, and he has some upper respiratory tract infection signs of sinus pain and congestion, bulging TMs, and audible nasal congestion. So hopefully that covers everything. Thank you so much. Bye.